Good afternoon, everyone, and welcome to Government's press conference for today, 5th May 2021. We welcome all of you who have tuned in this afternoon, and a special welcome to members of the press. I also want to say a special good afternoon to our Premier, Honorable Ellis Lorenzo Webster, and our Commissioner of Police, Mr. David Lynch. As always, we start with a word of prayer. Heavenly Father, we look up to you today, the one from which our help comes. As we open this press conference, we ask for wisdom and understanding in all we do and say. May your gracious hand of protection continue to be upon us, the people of Anguilla, as we go through these trying times. Bless us and heal our land. In Jesus' name, amen. Okay. Everyone is tuned in now. Today's press conference will take the following format. We'll have an opening statement by our Premier. He'll give us an update on some pressing matters. Then we'll go to a briefing from the Commissioner of Police, Mr. Lynch. We'll then follow up with some questions and answers after that. Mr. Premier, go right ahead.
Good afternoon, Honorable Merrick Richardson. Good afternoon to all and to all listening on a different media. It's Wednesday, the 5th of May, Cinco de Mayo, for those who are Mexican. Today, I just wanted to say, it's good to be here with another update. And certainly, I wanted to start off by talking a little bit about the vaccine, because there is still some hesitancy and some persons who are against it. Certainly, we understand, there are different theories out there. Some persons are concerned about the speed of the vaccine being developed. We do know that has been debunked because that technology has been there and technology has improved significantly over the years. We also know there are conspiracy theories, and certainly we try to explain the science and also the need for vaccination and how that is basically the best way for us to get back to a sense of normalcy. I just wanted to explain about herd immunity a little bit because there is, concern. Some people are asking why, if I get vaccinated, that helps my neighbor, the community. And herd immunity is when a high enough proportion of the population is vaccinated against the disease, in this case, COVID-19. They have antibodies against it. That is the defense mechanism. So there's a less chance that you can get infected with the virus. There's an increased chance that if you did get infected, a small percentage you can, that you would have no symptoms or mild symptoms. In most cases, less chance that you'd be hospitalized or have severe disease, less chance of dying from COVID-19. In fact, used to be said 100% chance of not dying from COVID-19. And significantly reduced chance that if you did get infected, you were one of that small percentage that you would pass it on to anyone else. So that is why it is essential to get vaccinated. Now, any one infected person, would have the opportunity to infect less than any one other susceptible person, thus halting the spread. So that is, if you are vaccinated and you're in that small percentage chance of getting infected, or somebody who's unvaccinated who got infected, if you have herd immunity, that is more than 70% of the population is vaccinated, then there's less chance that somebody who's infected would come in contact with somebody who is susceptible, that is, can get infected, because most of the population would be vaccinated. So the aim of herd immunity is to keep vulnerable groups who cannot get vaccinated, such as pregnant women, those who are allergic to the vaccine, children who are not yet cleared to get vaccinated, to keep them safe and protected from coming in contact with someone who's infected with the virus. And so that is why it is necessary to get vaccinated, so you have a less chance of getting the disease and less chance that someone who is infected coming in contact with somebody who cannot get vaccinated because the vaccine wasn't approved for their use. It is possible for a small percentage of fully vaccinated persons to get COVID-19, but most likely, as I said, the chance of that is very, very small, and the symptoms, and a very, very small chance that you'd get significant disease, and certainly a significantly reduced chance of spreading the virus. You know, some people were asking the questions, the persons in the hospital, what was their vaccination status? There's still 3 persons, males, who are hospitalized, and 1 was not vaccinated, and 2 of the persons had their first dose near the time of being exposed to the virus. At this point, I'd like to state that the 3 of them are stable and seem to be recovering slowly, but recovering. I'd like to give an update on where things are right now. We have there's 65 positive cases in the cluster. That is 64 here locally, and 1 who traveled on the 19th of April to the United Kingdom, became symptomatic, was tested there and was positive, but can be tracked back to the cluster here in Anguilla. That is out of 1,460 persons who have been tested through the contact tracing. In terms of the vaccination program, we have registered 7,930 persons, and I thank each one who is registered. Of those, 7,239 have had their first dose, which is 57% of the target of 12,600. And of those 7,239 who've had their first dose, 3,072 have had their second dose of the vaccine. I want to thank everyone who have chosen to be vaccinated, because it shows that we are heading towards that target where we need to be, so that we can get back to a state of normalcy, so that we can improve our health, so that we can be immune, so that we can open our borders. Because unless we get to that point, then we are not safe. And every one of us knows what our healthcare system is in Anguilla. It has limited capability. We have 10 beds. We've had, 65 or 64 cases here in Anguilla positive, 3 of those in the hospital. God forbid if we had more persons positive with that risk of ending up in the hospital, we certainly would have more persons who at risk of having severe disease, becoming critical and dying. And so that's why we are pushing so hard for persons to become vaccinated. So I thank those who have registered. I thank those who have already gotten their first doses, those who have gotten both doses, and want to commend you, and that comes from the bottom of my heart. So we have to beat COVID-19, and it's come up upon us. We have, stated that the more than likely based on where things are and looking at the history of Anguilla with this, that this most likely came from a case of illegal reentry. I know in St. Martin, I heard that there was a big uproar on the radio yesterday saying that the government of Anguilla is blaming St. Martin for this disease. We are saying that this most likely came from illegal reentry to Anguilla. So we can only blame ourselves for this. And certainly we also, if this spreads any further, we have to blame ourselves because we have asked you to stay at home. That way you can stay safe. That way you can stop the spread of this disease, which is a deadly infection. And so follow the regulations, stay home. Those are being reviewed right now, and assessments are being made by the health team, by the government officials, and in executive council tomorrow. Decisions will be made following on from that, and there will be press release to let you know and inform you what the plans are going forward. I just want to state that tomorrow also, Thursday, the 6th of May, is National Day of Prayer in Anguilla. I want to thank the Christian Council and Evangelical Association for putting this together. And I think that as a God-fearing nation, and we know that God is in the midst and has kept us safe this far, has been good to us and merciful to us, that we need to give him thanks and praise. And so I commend this initiative by the Evangelical Association and Christian Council and ask that we support this, all Anguillians here and abroad, because other countries have suffered from this virus more than we have lost citizens, loved ones. I have lost friends and loved ones and persons that I worked side by side with. And sometimes I feel guilty about it that, I am here and we were protected and they were not as fortunate. And I thank God for that he spared our lives here in Anguilla and spared us the ravages of the disease to this point. But it only takes one person who's positive getting out there in the community and causing trouble. So that's why I'm pleading with everyone: get vaccinated, stay home, stay safe, keep the rest of the country safe. This cluster is, a shot over the bow. Let's make sure that we do all that we can to protect ourselves and protect Anguilla. And so that's it for me for now, and certainly be available for questions after. I thank you very much for listening, and I thank you for looking out for yourself and for your fellow countrymen and women. Thank you.
Thank you, Dr. Webster. We now have an update from Mr. Lynch, Commissioner of Police.
Yeah, good afternoon, everyone. Again, a fairly short update because people are really helping protect everybody else on this island by being so compliant. Really, over the last 24 hours, we've done 7 land patrols. We have done 4 vehicle checkpoints. We've stopped a total of 13 vehicles, which is a good sign during that time because it means there's less movement around. Unfortunately, we had 14 breaches of the regulations. Some of them were people. One was a man walking his dog. One was a person out exercising. 5 people were driving around the island when they shouldn't have been. And all those sorts of people have been reported for summons. So that they'll be taken forward. We've done 3 sea patrols with the 2 boats we've got. I think I mentioned yesterday we've actually got one of the search and rescue boats back. That should be back in the water yesterday or today. We spotted 1 vessel, which was a vessel, we believe, from St. Martin. That was turned back during about 2 o'clock this morning when the officers were there and the weather was quite rough out there, but they turned that boat back. And very pleasingly, since we started the confidential email line, we've had 23 reports, all of which we followed up on about people breaching the regulations. And we're still trying to get the confidential helpline, the telephone up and running. A few technical problems, but we're trying to sort that out. But thank you to everybody for being so compliant. Thank you to everybody who's called in or emailed in to let us know what's going on. And we are sort of taking this very, very seriously. And thank you to the sea crew that were out last night, because it was very choppy weather last night when I saw the video this morning of intercepting this boat. So I think that's my overall assessment. Just to echo again what the Premier was saying, really, vaccination is the key out of this. So we really would appreciate, certainly from the RAPF's point of view, we'd appreciate people becoming vaccinated, because it does make our staff safer, it makes the health staff safer, and it makes everybody else on the island safer. So thank you very much.
Thank you, Mr. Lynch. Are there any questions from the press? Okay, Dan William, you can go ahead.
Good afternoon. James Howland here from Anguilla. A message for the Premier. In the recent newscast, it was said that government is working on lifting restrictions, particularly for those who are vaccinated. How will this be managed? What methods will you use to control?
Good afternoon, James. That's an excellent question. Yes, that is being considered right now, and we will, would by tomorrow be able to get you more information on how vaccinated persons will be, will have less restrictions. We do hope that persons will have their vaccination card, which is, given. I know that with the drive-through, some people may not have gotten their cards, but those will be distributed, and persons will be expected, if vaccinated, to show the card when those restrictions are reduced for vaccinated persons.
Thank you. Can I have a question on those who are being traced and tested? Would they be required to be vaccinated?
Well, we want everyone who is eligible to be vaccinated to be vaccinated. So the ones who have been traced, who are told to stay in isolation or in quarantine, we expect them to finish that term. We will be testing out those who've been positive and quarantined by this weekend. So we'll have more information, I would think, by next week as to how they're doing. But as I said, we want everyone that is eligible to be vaccinated. Now, the ones who have been positive, if they haven't been vaccinated, we want those vaccinated also, but usually wait for about 30 days after the symptoms to start vaccinating.
One final question on vaccinations. We realize, according to Mr. Gaston Brown, Prime Minister of Antigua, that we don't have much luxury to wait or to be hesitant. My question here is this. For the young people, those who are almost 18 years old, but not yet 18 years old, maybe they'll turn 18 in the next couple of days, a couple of weeks. Are they eligible to take the vaccination?
And that's a good question. In the U.S. and UK, Pfizer and is allowing persons down to 16 to be vaccinated, and they're doing studies now looking at those all the way down to 2 years old. And so, we haven't discussed that as yet, but certainly that is something. And if the persons who are eligible to be vaccinated now do not use up the vaccines that we have available, and we have persons who are just under 18, that might be a consideration. In terms of why Prime Minister Brown said what he said, we have been seeing that the more this virus spreads, the more it mutates as it multiplies, so the risk of having variants. And because viruses are opportunistic, they tend to, the more they mutate, is to get stronger, because by basically a process of, the fittest survives, evolution. And so that's why we see the variants, as they've been talking about, the Brazilian variant, the South Africa variant, at one time the UK variant, that these were stronger than the initial, the Wuhan variant. So that's why you want to be vaccinated, so that this virus cannot infect and then multiply, replicate, and then form new variants. While we're on that, we still do not have the variant that is in the cluster right now identified. COFA has told us they need usually 2 weeks to do the sequencing and testing, and so we're hoping by next week we should have some data on that for those, so that we will know what variant it is that is in Anguilla.
Thank you, sir. Thank you very much.
Very welcome. Thank you.
Thank you. I saw Don's hand up, and then we'll take a question from Brenda. Don, are you there? Okay, Brenda, can you hear me?
No, I'm
Yes,
here. You can't hear
I
me?
am here. Oh,
Can you hear me?
Yeah, we're hearing you now. Go ahead.
Okay, sorry. Premier, this is a question, or actually just a comment that I'm passing on to you. Tomorrow when you meet in Executive Council to discuss lifting or adjusting some of the restrictions for people that are vaccinated, I guess you will look at the 3 categories of vaccinations: those who have their first, those who have gotten their second jab, and those who have actually completed the 3 weeks after the second jab. So I'm assuming that there will be, hopefully, leeway adjusted and permitted based on the level of vaccination. Just throwing that out. And when the decision is made, the consensus on the island is, and I'm sure you've heard it, exercise please being the first restriction that will be lessened. Of course, doing it in an open area like the beach, socially distanced, etc. But exercising, I think, is really important for the mental health of people who are currently in lockdown. You can walk around your house 100 times, but it's just not the same as jogging or walking. So that's the first thing. And the second thing that I've been asked to pass on is people who are at home in lockdown status with not much to do, they really want to do some home projects. So tomorrow, again, when things are being reassessed for openings, if you could please look at hardware stores, opening them, maybe on a limited basis, but having people have access to the hardware stores so that they can buy stuff to do some do-it-at-home projects. And that is all I have. Thank you.
Thank you, Dawn. Those are good, observations. The first one, there will not be 3 categories, of course. It's fully vaccinated, which means 3 weeks, those who are 3 weeks or more post the second dose. Those who have had first and second doses who are not 3 weeks yet will not be considered fully vaccinated. And so the restrictions being lessened would not apply to those as yet. As we get to that level, then of course, those would then fall in that category of fully vaccinated. In terms of exercise, and certainly that is a consideration to expand, but we would still want persons, to practice the social and physical distancing, and so that will be considered in the hardware stores. Certainly, thanks for those comments.
Thank you.
Welcome.
Brenda, you can go ahead.
Good afternoon. Just to follow up on the vaccination cards, a number of people have not received their cards and are asking about it, but we've been told to stay home. Where do they collect them? How do they collect them? Is it okay to go out and collect them? And following on from that, are we eventually still going to get the laminated cards?
Good afternoon, Brenda. Thank you. Persons will be notified where they can get their cards, and certainly DITES, the Department for Information Technology and E-Government Services, is working with us to get those laminated cards similar to the voters registration cards as soon as that is possible. So we are working on that, and we will let you know and let persons know where they can get their vaccination card. Because of the drive-through and wanting to move people along, we haven't been able to do that right at the time, but we certainly, and that's a good problem to have, because it means that persons are coming for their second dose, and we want to get persons coming for their first dose also, so that we can get up to that target that we have. And also knowing that the vaccine that we have the first batch has an expiration date of May 31st. So we'd like to have, all those first doses and, as soon as we can, and certainly, by May 15, so that we can use up the next batch on the second doses. However, if we get, we have, 20,000 doses. If we can get to our target population of 12,600, then we are assured that we will get enough doses to give persons their second dose.
Okay, thank you. We have the Anguillian. You can go ahead with your question.
Yes, a question on holidays. There are 2 more upcoming holidays in the month of May, May 24th, which is with Monday, and Anguilla Day, which is May 30th. How does government intend to deal with activities and the control of crowds on these holidays?
Thank you for that question, James. Certainly, those, we do know about those coming up, and it will depend on the regulations that are in place at that time. And so we will be informing how that will be done. I can assure you that at this point in time, Anguilla Day, we do not intend to have mass gathering, and similar. It'd probably be similar to what we did last year, or what was done last Anguilla Day. But we will get that information out as soon as possible, so that persons can govern themselves accordingly. It will be based on the regulations in place at that time.
Class FM, I see your hand up. You can go ahead.
Yes, good afternoon to you. Good afternoon to our Premier and the team there. I have a question for you. I know we sometime earlier we spoke about persons who wanted to come to Anguilla, returning nationals. I have a question for you. Ask about persons who need to return to Anguilla. What is the process for that? There are persons who said they bought tickets and wish to return home. How should they conduct themselves?
Thank you very much, Emma. Certainly it's unfortunate that we had to close the borders because of this cluster, and it is to protect and to help save lives for safety. We are discussing that, and that will be determined in Executive Council tomorrow. Those regulations will be finalized. However, as was stated in the press release yesterday, the borders will remain closed for incoming persons at least through May 21st. And this allows there are two reasons. One is that in terms of resources, the health team is right now tied up with contact tracing, with testing. We'll be tied up with testing those who are in isolation and quarantine to make sure that those clear and have negative tests. And so it's difficult to have them doing that at the scale that they're doing it, and also be able to have persons at the port, doing testing for persons coming in, for monitoring those who have to go into quarantine. So that's right now the emphasis is to get through this cluster, make sure persons are safe before we open up the borders. Persons can leave when they need to, but certainly coming in at least until May 21st at this point in time. And then we'll, those regulations, as I said, and decisions will be made public after tomorrow's Executive Council meeting.
One more question for you, Premier Webster. A question came into me a while ago. When is the cutoff date for the first dose as relates to the expiry date, the batch of vaccines we have here?
We would like persons to be vaccinated by May 15th on their first dose. And the reason for this is that the first set of doses we got, 12,000 doses, will expire by the end of May. However, and the second batch expires by the end of July. AstraZeneca recommended that the closer you get to 12 weeks away between doses, that you have better coverage. However, we've been doing about 8 weeks between doses. So we would like by May 1st to have had all the first doses in. Then it would have been 8 weeks between that and getting using up the second batch that we have by July 31st. But we're saying we'll crunch it down to about 6 weeks in between if we can. That still shows that there's good efficacy of the vaccine, close to 90% with the 2 doses. And so that is why, but we need to get these doses into arms, definitely before they expire, because there are persons out there, even in the UK where we got this vaccines, who are still waiting to get vaccines. And we have been fortunate that the United Kingdom government committed to providing vaccines for us. I remember when we came into government back in July, there was a request for us to join the COVAX facility, and we would have had to pay 15% down payment, which is a lot of money that we would have had paid to try to guarantee vaccines. But there are countries who have paid their down payment and were still waiting to get the vaccines because they're in such short supply. And so we would have been most likely at the bottom of that list, given our small size and the amount that we would have needed. So I want to thank the United Kingdom government for providing the vaccines for us. And I'd like to thank those Anguillians who have taken it upon themselves to go and get vaccinated. And I'm asking that the rest of us who are eligible. And I say us because we're all in this together. You know, I've been vaccinated. I have my 2 doses. I am now fully vaccinated because my second dose was on the 12th of April. So I've made the 3 weeks. And, you know, but we all need to get there, you know, for ourselves and for each other. So that's why we're asking persons to go and get vaccinated. And as I said, the ones May 15 is just around the corner, and that we'd like to get all the first doses in so we can get the second doses in by the end of July. And if we need to, you know, do more hours, you know, we already spread thin with our vaccination team, but if we had to add days, extend hours to do it, we would do that, because we know the importance of being vaccinated. And this country, Anguilla, it's just like any other crisis we've ever had. Hurricanes, we all pitched in and helped each other to build back better. You know, the revolution that we had, everybody got on board and manned the beaches and protected this country. This is a similar crisis that we have now, and we have to protect this country. And so I'm just asking that we all understand the significance and importance of doing that.
Okay, and so one last question, final question for you. I realize in recent days you'd have doubled down on your intention of making it mandatory. Where are we with that now in terms of status report as to what's happening in that regard? Is that still on the cards, sir?
That is still on the cards, Hammer. And as I said, we, you know, we try moral suasion. We try to explain, you know, how scientifically that this vaccine is helpful. I thank you for making it public that you took the vaccine, and you know, and I think that is the right step. That shows that, you know, we take this seriously. We want to protect ourselves and protect the community. But for frontline workers, you know, those who are going to be exposed to persons that may be infected, those would be the first persons that can get, you know, infected. And we want to make sure that those are vaccinated. And that protects not only the person, but the person next to them. And also, if you think about them having to go home to their elderly parents, or who may have chronic non-communicable diseases, who are vulnerable, or to their children who cannot be vaccinated at this point in time because it has not been approved as yet in children. And so, yes, that's still, you know, on the books, and the Attorney General Chambers is working on the regulations for that, so that, you know, we can get that. And at some point, the Deputy Governor will be on to talk about, you know, this in terms of public workers, and certainly in the hospitality sector. And that is important, that persons who are going to be the first contacts with persons coming in, even though we are pushing to make sure that visitors to Anguilla will have to be vaccinated when they come, there's still that risk, you know, especially now the COVID, you know, this cluster. We have to make sure this cluster is controlled. And so, yes, so that's still, you know, in consideration.
One last question. I said that a final a while ago, but just one more for one of our listeners here. Hammer, can applicants applications to the portal be reopened immediately after the date has been announced? This is from one of my hotelier clients here on Class FM. That's the question. I guess they're referring to reopening of Anguilla at some point in time. And the question is, can the applicants portal be reopened immediately after the date has been announced? That's my final question.
Yes, I can assure you that will happen. Right now, there is a transition from one provider to the next, but the portal will be opened so that persons can apply to come into Anguilla, providing their vaccination status, and also providing their testing status, because they'll still be required to test 3 to 5 days before they come.
We'll take a question from Don, then we'll take one from you, Brenda.
Thank you. I'd just like to offer some information about the vaccination card, the blue vaccination card, and it's based on what I did this morning, actually. You can walk into the park, the Ronald Webster Park. There's a security guard that's standing at the entrance. He gives you a little coupon with a number on it. You sit in the stands, and then you are called up to a desk that's adjacent to the tents where you actually get your jab. And there's a pile of blue forms. You give them the name, and they go through, and if your form is ready, you get it. The person that I collected the form for, she got her jab last Thursday, and the form was ready. So I left about 30 minutes later with her form in my hand. And I'd just like to add that the person, the vaccination team person that was sitting at the desk handing out these forms, I mean, I could tell she was tired. So I asked her if people who were fully vaccinated could come and assist, volunteer. And she said, well, you know, that's not for me to say, but, you know, you can up-channel it. So Premier, I'm up-channeling it. If there's a volunteer pool, anybody needs help, there are people who are willing to lend a hand. Thank you.
Thank you for that information, Dawn. And certainly, you know, volunteerism is something that Anguilla is known for. And I too will pass that on to the health team and see how we can, you know, facilitate these things going forward. Thank you very much.
Brenda?
I don't have my hand up.
Oh, it is probably from before. The Anguillian, I see your hand up. You can go ahead with your question.
Yes, I want to say too that I'm happy to report that I've taken my second dose yesterday, and it went well. I have a question for the Premier. Is there an MOU for vaccinations between the Anguilla government and the UK government? And if so, what are the particulars of this MOU?
There is an MOU that was signed. There's a MOU that was signed between the UK government and AstraZeneca, which is the company that provided the vaccines. And that MOU then translate to the regulatory agency, to the government of Anguilla, the Ministry of Health. And you know, what's in it? Basically, it talks about the vaccine. It talks about, you know, any type of liability. So these are things that are standard in those types of MOUs. And, you know, we were happy that the UK government was able to provide vaccine doses for Anguilla from the stocks that they had. And thank you for getting vaccinated, James.
You're welcome, sir. I have a question for the Commissioner. Commissioner, can you tell us any details concerning the boat that was intercepted at 2 o'clock this morning?
Yeah, the boat was intercepted at 2 o'clock this morning. It's a small fishing type boat. It was spoken to by the officers on board. It was turned back. They thought it came back in, but we believe it went back as well. We're absolutely convinced it never got to the island. It looked to be a fishing boat. So that's, we believe it's gone back to the island. We don't believe there's been a breach of that border area.
Was it a St. Martin fishing boat, sir?
Sorry, just say that again.
Was it a St. Martin fishing boat?
Yeah, it was a fishing boat from St. Martin.
Thank you, sir.
Class FM, I see your hand up. You can go ahead.
And a question for the Minister of Health, Dr. Webster. For persons here who can't take the vaccine, would they be able to get a card? Is that possible?
I mean, it should be possible if it's, you know, that they get something saying that they're ineligible. You know, I would think so, but I have not discussed that with my team in the Ministry of Health as yet. Certainly, what we are asking is for those persons who can't be vaccinated to be protected. If we get, you know, herd immunity, where over 70% of the population is vaccinated, then there's less risk for those persons to become infected.
Dan William, your hand is still up. Is that from before, or do you have a new question? Okay.
That's an error.
Okay. Any more questions from the press? Okay, if there are no more questions, I think we can start to bring this press conference to a close. Commissioner Lynch, can you give us your closing remarks, which will be followed by the Premier?
Yeah, really, much like I started my presentation off today, was just to thank everybody. There's been fantastic compliance. It's really appreciated by my staff, and I think it's appreciated by all the friends and families of all the people who are absolutely being committed to this lockdown process. I think the second thing is to just remind everybody about hands, face and space. There seems to be huge compliance, but occasionally you get the odd person who forgets to wear a mask or whatever, but please hands, face and space, wash your hands regularly, cover your face and try and keep some space around you. And thirdly, just to remind everybody about the confidential email line, which is www.gov.ai/911. If you've got information about any breaches, please let us know. We will respond and we'll try and make sure that there are no breaches at all. Just thank you very much.
Honorable Premier, can we get your closing remarks?
Certainly. Thank you, moderator. You did an awesome job, you know, getting us through this, facilitating it. I was hoping there were more questions for Commissioner Lynch, so you could have kept me off the hot seat, but that, I guess they say it flows downhill, right? You know, what I want to say, you know, is just reiterate what the Commissioner said about, you know, persons basically following the regulations. You know, stay home. We will come out with some, you know, changes in the next day or so, and you know, listen in so that we can see. We want to, you know, reward those who become vaccinated, because not just to reward them, but to let them know that by doing that, they're basically protecting themselves, protecting others around them, and so there should be less restrictions in that regard. But until we get enough people vaccinated, then we can't let our guard down, because that's when we get into trouble, when we do. So we will continue that masks have to be worn, especially indoors and when they're around, you know, persons, other persons, to protect ourselves and those around us. We will, you know, continue to be monitoring. There will be some, as I said, some relaxation of the regulations, and those we will decide in Executive Council. But again, we have to be vigilant. We have to maintain that. And also, the Ministry of Health has COVID-19 hotlines. The numbers 476-7627 or 476-SOAP or 584-4263, 584-HAND. These you can call, ask questions, you know, if there are any concerns at all. If someone feels they may have been exposed, certainly call so that you're told what to do. If you have symptoms of that would suggest like a cold or flu, any type of respiratory symptoms, call, and you will be informed of how to where to go to be tested. And certainly want persons to remain healthy and to be safe. So stay home, protect yourself, protect the community. And, certainly we're working hard to get Anguilla back to a sense of normalcy, back to where we were, where we can commune and fellowship with each other. We, don't like that we are not able to see each other like we used to. But certainly this is for our own good at this point in time. So thanks to everyone. Thank you, Commissioner, for being here, for enforcing the regulations and being so strict about it, because that's the only way we can protect ourselves and the community. And thank you, moderator. Thank everyone, the media, for getting the word out. And we will, after Executive Council, have another presentation, press release tomorrow, I anticipate. And then on Friday at 3 p.m. will be our next press conference, and look forward to keeping you informed about where we are and how we're progressing. So continue, stay home, except to go and get vaccinated, and also for essential services. Thanks again. God bless you. May God continue to bless Anguilla.